have hope. If you're in a toxic environment, find ways to step back and, maybe slow down or stop work altogether if you are in a toxic environment. Because a lot of the times what we need is some space and distance or a wake-up call, like what I had, but hopefully you don't have a wake-up call. Because burnout can be really, it's not just a word we throw around when you're feeling tired. It's much more than that. And so I think it's important, if you think you have signs and symptoms of burnout, to reach out to a colleague, mentor, friend, a coach, a healthcare provider, because you want to get help. And there are ways to feel better, to be happier, to thrive. But it's really important to address these symptoms when you start to notice them.
I'm Riley Reese. This is the Sofia Unfiltered Podcast, where we bring together thought leaders, wellness entrepreneurs, makers, and emerging health leaders. We're here to have raw, unfiltered conversations because sharing your stories has the power to change lives, help others heal, and transform the way we take care of ourselves. Here we go. Hi, everyone, and welcome back to another Sofia Unfiltered. I'm your host, Riley Reese, and today we're sitting down with Dr. Shani Esparaz. She is a board-certified ophthalmologist, a lifestyle medicine specialist, and a certified health and well-being coach. In the past year, she's established Envision Ophthalmology and Wellness, a direct care ophthalmology practice. We are so excited to sit down with her and hear her story. Dr. Shani, welcome. How are you?
I'm great. Thank you so much, Riley, for inviting me on the show today. I am super excited for our chat.
Yeah, likewise. Well, for our listeners who may not have heard of you just yet in your practice, do you want to tell them a little bit about your background, and we'll just jump in from there?
I'd love to. Yeah. So I am by training a ophthalmologist. So I focus on laser and surgery procedures to save vision and improve vision. And initially, when I went to medical school, I actually thought I wanted to be a pediatric endocrinologist, meaning I wanted to work with kids, especially kids with diabetes or at risk for diabetes. But my path in medical school took me elsewhere, and I realized I really liked using my hands to help heal. So that's how I started looking into different surgery specialties and landed on ophthalmology after just seeing how neat the field was, the intricate surgeries, and I really wanted to help people see better. And so fast forward, I did my medical training and then residency and fellowship, and then I landed my first job as a physician. And it was great. I was really busy out of training. I was doing everything I had trained to do, ophthalmology, cataract surgery, injections. And then a few years into being an attending, I started experiencing some mental and physical signs of burnout. And at that time, I really didn't know what those signs and symptoms were. But I just knew something was different, something wasn't right. And I thought it was all from me, must be me. And so I went on kind of a health and wellness journey and decided to get board certified in lifestyle medicine, which is basically the things we should have learned in medical school, like how to really take care of yourself through evidence-based approaches like nutrition and movement and sleep, how important sleep is, and stress reduction and mindfulness. So I kind of took a selfish detour and went on a health journey and learned more about evidence-based wellness. And then I enjoyed it so much that I decided to get certified in health and wellness coaching, because coaching really is helping you, yourself, and others really create sustainable and long-lasting changes that work. And so that's kind of led me down a path. I'm still in ophthalmology, but doing other things as well.
Yeah, so interesting. And so, you mentioned something I think is pretty significant, which is you said I guess looking back, you noticed that you were exhibiting signs of burnout. But for our listeners, can you share a little bit about, what was going on the day in the life? Like, how did you not notice it as a physician, right? What did that look like?
Yeah, so I started noticing that I was getting more and more like physically tired. I would go home and kind of worry more than I used to be. I wasn't like someone I would consider like a worrywart. But I would go home and worry about patient challenges or complications. And I think that disrupted my sleep. I also was getting some GI issues and I actually went to see like a GI specialist because I was like, do I have a tumor in my stomach or what's going on? And I actually had like an EGD, like a scope, and everything was normal. So I was, having fatigue, some GI symptoms, headache, and then just this like mental fog that like I would go into work and do what I was supposed to do, but I would just really feel run down. And so I just really thought this was all me, like something must be wrong with me. So that's why I went to see, doctors and specialists, and they're like, nope, you're healthy physically. So those were my signs of burnout. I also found that I was going into work and sort of dreading it, which is, not what you want when your line of duty or job is working with patients and making, critical, life-saving, vision-saving decisions. And so I thought, again, something was wrong with me because I had worked so hard to get to this point in my life. From the time I was little, I wanted to be a doctor, but I just, was feeling different about it when I was going through burnout.
Yeah, absolutely. And I know you also mentioned too, like there was a wake up call moment, right? When you said you kind of didn't realize issues were going on. I don't know, I guess with your kids, what was going on? What happened?
Yeah. Yeah. So my husband is in medicine as well. And so about 2 or 3 years into us being full-fledged attendings, really busy in practice, we have 2 young kids. And at that time, our oldest one was about 4 and our youngest one was about 2. And my husband and I were both going through burnout at the same time. Again, we didn't really recognize the signs and symptoms, nor how important it really was till we got this wake up call for us to change our lifestyle. So my husband and I were kind of like ships passing in the night, go to work, come home, exhausted, see the kids for a little bit, put them to bed, wake up, do the same thing. And we, at that time, because we were so busy, we had a full-time nanny who had been with us for a couple of years, actually. She was like part of our family, an extension. I'm a huge fan of outsourcing because that's what you have to do when you're a busy mom. And our nanny had gone on maternity leave. She had her own child and had come back from maternity leave recently. And within a couple of months, we had to let her go. We had not noticed signs because, again, we just weren't present at home, like physically and mentally. When we were at home, we were exhausted. But one day we came home and I noticed, signs that something just wasn't adding up with my kids. I noticed that my youngest daughter, had a scratch or cut on her tongue, and our nanny couldn't explain it. I said, this looks like, did she fall and bite her tongue? What happened here? And our nanny just couldn't, explain what happened. And so we did a little investigating on our own. We actually have cameras in our house that we never felt we had a reason to look at, but we did because things weren't adding up. And we found out that my daughter had choked when she was unattended by the nanny. And when we confronted our nanny about that, she said she reported to us that she was undergoing postpartum depression. And so, it was kind of a wake up call, like, okay, our childcare is not safe to take care of our children, and our nanny needs to go and, get treatment herself. And so, just not being, when something happens to your child, like,
Yep.
Nobody messes with you, it's like, whoa.
Yeah.
Why did I work so hard to get to this point in my career with, all these procedures and accolades and things like that if I'm not a present parent, a present partner, a present person? So that was like a huge wake-up call. I hope that, no one's ever in that situation, but it really, unfortunately, sometimes it takes wake-up calls like this to really take a step back, make you slow down and look at your life. Thankfully, my children are doing fine. We, have really changed our lifestyle around where now we focus more on, what do we want out of our lifestyle? And then how can work, as much as possible, because we can't control everything with work, but how can we make our work lifestyle work better with our personal lifestyle of taking care of ourselves, being more mindful, eating better, sleeping better. And so I am proud to say that now, a couple of years later, I am a much happier physician. I'm no longer burnt out. I really enjoy what I do in medicine. And I'm also really enjoying being a mom, being a wife.
Yeah, no, that's amazing. And I think, women especially, I know men are there as well, but, I have a son, he's 14 months old. And I just think I totally hear you, right? Like we'll put ourselves last, but the minute something presents in your kids, that mama bear instinct is going to kick in and you're like, okay, now it's, time to do something. So when all of this was happening, is that when you really were like, okay, what's going on with this lifestyle medicine component? And you were starting to jump into this well-being journey. Is that kind of how that unfolded? You're like, okay, I'm going to kind of take this a little bit more seriously and look at all of these components because not only are you're a mom, you're also a partner, a spouse, like you mentioned, human. Like there's a lot of components with women specifically, right?
Yeah, yeah. And again, I think it's so important that you bring up that, especially we as women just feel like we have to hold ourselves to this like perfectionist ideal because that's again how we're groomed and how we're raised. Don't make mistakes, think about others first, take care of everybody else. But at the end of the day, if you aren't taken care of, like all the people that depend on you, your kids, your household, your patients, like they're not going to be taken care of as well as maybe they should be. I read a quote yesterday, a woman's health is her capital.
Mm.
And so putting that into perspective, like when we think of, things that we buy and invest in, a lot of us have not thought about investing in ourselves and our own health because that is our wealth. And that is going to help us really live a life to our fullest satisfaction and really work through burnout. So yeah, this wake up call really helped me push me to dive into how do I take care of myself? How do I take care of other people? How do I get more out of the here and now? Because in medicine, a lot of us are working towards, okay, when I get that new promotion or when I get, professorship versus assistant professorship, I'll be happy. And we keep waiting and waiting and waiting and going up in our career. And it's like, are we waiting till we retire to then take care of our health and wellness or to travel or to spend time with our kids? So I'm really trying to encourage others to get more out of the here and now instead of waiting till everything's perfect.
You're waiting for that promotion and then I'm going to be happy. And then I'm going to, meet my kids for dinner. I can't even imagine how busy you are as a physician, but I think that's a really good point, right? That being, maybe using the tools like meditation and mindfulness practices, right? To try to say, okay, well, this is where we are today and being happy. So, but the journey of going back, and you also mentioned that, all the things you should have learned in medical school, but didn't, like the things that actually help take care of us, right? Look, running Sofia Health, we have physicians on the platform. We all know this. I'm a big believer in the physicians, but I do think that we also have an acute healthcare system and we have kind of a chronic disease population. And so I think that means, day to day when we need surgeries and pills and, coming to you for our lasers on our eyes, all the things, I think it's amazing. But I think day to day, our mental health, our, emotional health, like how are we going to survive day to day? Like we can be actually physically healthy, but actually be sick, right? Like not doing well, like emotional turmoil, this chaos, we're not taking care of ourselves, and now as a new mom, I can see how a lot of times maybe moms or new parents feel like thinking about taking care of yourself could be selfish, right?
Mhm.
So on your
Right.
journey of well-being and then with your medical background, what did that look like when you started learning about wellness and the health and well-being coaching? What was that like for
Yeah.
you as a physician who knows everything, right? We all assume physicians know everything.
Oh, we definitely don't. And that's why I did more training. And I think we're all a work in progress for sure. And especially like you mentioned, if you become a mother, your perspective on life changes a lot. And so it's, starting to think about how do I nourish myself? How do I move my body? How do I take care of my mind so that I can be a present mother and model those behaviors for my children? So my journey really started with the pillars of lifestyle medicine. And again, it's very simple and realistic and evidence-based. That's what I really enjoyed about learning about lifestyle medicine. Because at the end of the day, it has to be simple, it has to make sense, and it has to be worth your time, right? You don't want to go and buy, some wellness pill that's you're going to spend lots of money on and it's not going to work. It's like taking a sugar pill or something like
Quick fix
that.
pills, but everybody
Yeah,
loves them, right?
right. If only we could just hit a button and
Quick fix
reset our
diets,
health.
quick fix everything. Yeah.
Right. And so health change really, it's simple. It starts with small changes that add up over a long period of time to large changes. And so part of going on a health and wellness journey is having some patience and realizing it's going to take time to change the habits you want to change. But it's so worth it because once you find something that's simple, realistic, and works for you with your lifestyle, nothing's going to rock that boat. Something might come up, a death in the family, a challenging patient complication, something at work or in your home life. And if you have sustainable wellness routines and ways of thinking in your mind about your wellness, it's going to work for the long run and it doesn't have to be expensive. So with my health and wellness journey, again, I focus on the 6 pillars of lifestyle medicine. So working on more of a whole foods, plant-based nutrition. I am by no means a strict plant eater. I think there's different ways to approach nutrition, but I just really wanted to focus on getting more whole grains and fruits and vegetables in my diet.
Yeah,
I
you
also
mentioned
looked
just
at
being
movement.
super busy, right? Like there's
Yeah,
busy moms, like you're on the go. Like we put nutrition, like grab something last minute, maybe fast foods. And I imagine being in a hospital environment, you're always just, okay, eating's kind of a last priority. I can see how that is for everybody. So when we say talk about whole foods, it's probably getting into like, okay, understand how busy your life is and maybe try to incorporate some of these fruits and veggies in when you can, maybe take snacks, be a little bit more
right.
mindful about remembering to eat.
Right. In our surgery rotation as a medical student, the mantra is sleep when you can, eat when you can, and go to the bathroom, repeat when you can. So exactly, you want to find a way to get some whole foods nutrition into your diet. And it doesn't have to be radical. It doesn't mean you got to start meal prepping all your meals and all your snacks. No, that's impossible.
Yeah, we're
Especially
talking
with a busy
basics.
lifestyle. Yeah, we're like, maybe it's like putting a handful of bag full of nuts in your work bag so that you have something to just grab. You don't have to meal prep nuts. Maybe it's, getting some protein bars or, already made foods that are nutritious for you and going to keep you full, but you don't have to meal prep everything. Or maybe it's just making mindful choices when you're in the hospital lounge. Maybe it's first serving yourself fruits and vegetables on your plate and then adding the grains and proteins, just small little things over time will add up. It doesn't have to be complicated.
Yeah, that's nutrition's probably a very important piece of this.
Yes. Yeah. And then along with nutrition is moving your body. And a lot of people are like, well, I don't know if I have time to go to the gym. You don't have to go to the gym. Maybe it's taking the stairs instead of the elevator at work. Maybe it's just standing up and pumping your legs a few times a day or going outside on your lunch break if you get a lunch break just for a few minutes. I mean, studies have shown even walking for 10 extra minutes a day can significantly reduce your risk of heart disease, cancer, stroke. So again, just taking a few extra steps a day can be so great for your health. You don't need to go and run, miles at the gym. Other things along with nutrition and movement is sleep. I think, especially in healthcare, sometimes we undervalue sleep. We're on these crazy night calls and shifts, post call and so forth. And I think we really underutilize sleep. Sleep is a tool to actually help us repair our body, help us with focus and energy for the next day, and actually helps regulate our weight as well. So, trying to get to a consistent sleep time if you can. It's hard as a new mom, but it gets better with time. So trying to go to bed at the same time and wake up the same time most days out of the week. Having a sleep routine that you look forward to. Maybe it's putting on your favorite Netflix show, taking a warm bath, drinking some warm chamomile tea before bed or journaling. Make bedtime something to look forward to and then utilize sleep as a tool when you can. It comes with a caveat.
Exactly. Okay, so we've got 6 pillars. We've got nutrition, movement, sleep.
Mm-hmm. Mindfulness is a big one. Mindfulness / like stress reduction. And a lot of this is with the kind of thinking of those mindset shifts that we kind of talked about. Just realizing that stress is part of our life, and there's some stress that we can change, and then there's some stress that that's out of our control. One thing that's really helped me with mindset has been journaling. I am not one to just sit down and write my thoughts. I was never like that. And so I actually got a journal that had prompts in it, and it prompts you to write things in the morning versus evening. And just doing that small act really helped me start to see things in my day, for example, as a mom, that I kind of was brushing past. So I would journal, and it would answering the prompts.
Can you give us a specific example of that?
Yeah. Yeah. So one of the prompts is, what was the best part of today? And so like 3 things. And so when I look back at my day, for example, one thing I remembered journaling one day was I loved dropping my daughter off and the fact that she turned around and waved at me. Now she's 7, so she's kind of at that age where you're in front of their friends, they want to get away from you more, and they don't, it's not as lovey-dovey as like a 2-year-old sometimes. And so I wrote that down in my journal, and I was like, normally I would brush past that if I didn't really reflect on my day and what made me happy. The other things were, helping a patient see better and, getting in a 10-minute walk. But brushing past that little piece of joy, I mean, think about all the little tiny pieces of joy that we might be brushing past. And studies have shown in positive psychology that recognizing these little tiny pockets of glimmer of joy can actually improve so much of our mental health, our mindfulness, just helping us step back and become more intentional about our day. And so then when I recognized that, I said, okay, I want to do more of that, or notice that, interaction more with my child when I drop her off. It's not every day that she turns around and waves, but when she does, it's really special. And, kids, as you know, grow up fast. And so really soaking in and being present as a mom has become more natural to me now that I'm more mindful.
Yeah, I think that's such a great example. And I think in mindfulness, they talk about being grateful. If we're always complaining or always, living in that stressed kind of mode, like just take a minute to be grateful for what you do have, and it will actually can bring about a whole different mood.
Right.
So I think that's one of those things you're like, oh my gosh, I, was actually really happy that she waved at me, or you got the baby kisses, or, just stopping all of the stresses and just being grateful for a minute can actually probably lower stress and make it
for sure. For sure. And it's free, and it's just part of your lifestyle. Again, capitalizing on your own lifestyle to improve your mental well-being. And studies have shown, we are what we tell ourselves. So exactly, the more that we practice gratitude, the more that we're going to see the positive around us, and the more that we ourselves are going to be a more positive kind of beacon of light. And so it becomes infectious and contagious. So imagine if you're feeling more grateful, your kids are going to notice that, your patients are going to notice that, your friends and family, and it's just going to be like this trickling down of gratitude and positivity, which we could all use.
Yeah, but I think you said something really powerful, right? Like we are what we believe we are and what we tell ourselves. So I think that making sure we're in the right mental space is really important, because if we're not telling ourselves good, happy, positive thoughts, and we're always criticizing and going through in that way, I mean, that will ultimately also take an effect as well.
For sure. For sure. I think especially as busy women, we could use more of that self-talk, that self-positivity, because again, we hold ourselves to such high standards, and we're such perfectionists that realizing, hey, I did a really great job with that meeting today, or, I, made a really great meal and my kids enjoyed it. Just these little things do add up. So I highly recommend journaling.
Or something simple like everybody's healthy in my house today, right? I remember winter was brutal. Right. So it was like, winter, okay, we're all not sick. Like we're all healthy today. It's a good day. We're not in the ER today. No rashes, no allergies. Like just being happy about small things. Like we all have our health today, and we should be super grateful. I mean, that's kind of where we got to over the winter with with flu. Okay,
Yes.
so on our 6 pillars, nutrition, movement, sleep, mindfulness.
And then the other one is the two others. So the next one is positive social connection. So that means spending time with others. And again, this doesn't have to be hours of time. You don't have to be the most extroverted person or have tons of friends. It's just about connecting with someone. Studies have shown even for 10 minutes a day, whether it's a colleague or a friend or a family member in person or
Mom's
on
at
the
the
phone.
park.
Right, right. Whoever it might be, just having a stimulating, engaging conversation helps them with their health. There are studies out of Harvard, Robert Waldinger, he's a Harvard psychologist who looked at like the healthiest 80-year-olds, 89-year-olds around the world. And what he found was these 80 to 9-year-olds were not only very healthy, but very happy. And what he found in common was this strong sense of positive social connection, being around others, speaking with others. Loneliness kills. And so making that extra effort to reach out to a friend or a family member, it's interesting because in medicine, we're often told to kind of like put our heads down, stick to your books, get that next test done, go to work, see your patients. And it's really not we're not as encouraged to, form connections and community. And I think we're talking more and more about that, especially with talking more about burnout and things like that. So I really want to underscore the importance of making connections with other people. It's good for your health. And then the last pillar is avoidance of risky substances, which in traditional lifestyle medicine, when we're working with patients, it's usually talking about avoiding alcohol and tobacco, which we know are detrimental to our health in a variety of ways. When I work with other women professionals and women in healthcare, I often take this pillar and I change it or tweak it slightly to avoid toxic habits like people pleasing, saying yes when you really want to say no, like setting down boundaries, and then working on perfectionism. We are in a society where we as women, again, hold ourselves to such high standards, always want to say yes when we actually really need to say no sometimes to extra commitments because time is valuable. And then we also are very, very, sometimes we really want to people please, again, to climb in our career ladder or whatever it might be. But
Career ladders,
really,
social ladders. I mean,
right.
it's always something.
Always something. And so I encourage the women that I coach to really start to become aware of when you're doing these, what I call toxic habits or toxic traits. And the more aware you become of it, the more obvious it sometimes becomes like, hey, I totally went into that meeting and now I've left with like 5 other things on my plate that, I'm not even being compensated for or getting time to do. So once you become more aware, then you become more intentional. So the next time you're in a meeting, you're leaving with delegating those tasks or kind of putting a boundary like, hey, I'm doing XYZ. I think so-and-so might be best suited for, these other tasks and so forth. And so I think really, putting down boundaries and, don't be worried so much about people pleasing. You're going to get a lot more out of your time and your health and well-being.
Yeah, I think these 6 pillars are absolutely fundamental, right, to create this sustainable life and kind of cut that stress. So, as far as your journey goes, I mean, you said it was years ago that you noticed this. Did it take years to get to this position where you're finally better? Like, can you walk us through a little bit about, how fast did these changes work? Like, everybody wants it instant. Okay, like, are we talking a week? Is this going to take a month? Or is this like, hey, the minute I started practicing, just being grateful for 5 minutes a day, my outlook was better? I mean, what are we talking here?
Yeah. And that's a great question because I do think everyone's journey is a little different. And I think number one, embracing your journey and realizing that this is going to take time. It takes work to, be in a happier and healthier place in your life. And I will also say that your life goes through different phases and it shifts. So for me, I actually got coached for about 3 months. And that helped me really implement these lifestyle changes, because a lot of us know I should be eating more of this, or I should be moving more, or I should be sleeping more. But the hard part is following through on that. Whether it's, motivation is one thing, but really consistency, habit formation, accountability. So I worked with a coach, and then I got coached myself. So I worked with a coach for 3 months, and I started noticing after 3 months the beginnings of these sustainable mindset shifts.
Wow.
And so after that, it was probably another year of when I kind of decided to cut back at work, open up my own practice. And so it's been quite a journey. And so I'd say it's kind of hard to put a number on it, but I would say, 3 to 6 months of working with a coach can really be beneficial for women that, are busy, but know that they need to make a change, but have been unsuccessful perhaps on their own. And you want to get there faster, right? There's no instant button, but.
And we shouldn't want to either, if we really look at it. That's super insightful. Can you tell our listeners a little bit, you said your husband was also going through burnout as well at the same time. You both probably had this wake up call, like, oh my gosh, this is going on with our kids. We have to do something. But what was his journey? Like, it must be so different, right? We keep talking about women, but what did your husband's journey look like a little bit? Was he getting coaching? Were you just telling him what you learned?
Let's see, he got free coaching. How about that?
Okay. He got coached.
Yeah, he got coached, whether he wanted to or not. But, I really appreciate that question, because I do think that there are more and more resources out there for women and women's health. And my husband, who's a physician, he goes through certain things in medicine that I might not, and vice versa. But I do think that it's important to recognize that the changing role of males in our society, and he is a very much dedicated father and contributes to the household as well. And so you're right, we were going through this together. I think when you're going, when you have a wake up call and then you go through a change, it's really nice to have someone else to go through this change with. And so I started kind of going through these lifestyle changes. I started waking up earlier and moving my body more. And then I was kind of in charge of like what we eat, because I did the grocery shopping and meal prepping. And so it was kind of like this catalyst. And then he kind of saw what I was doing, and he was like, maybe I should try that too. And so he got into certain things with nutrition. For him, it was more of like macro counting for a period of time to kind of get more intentional and aware about what he was eating, how he was feeling his body. And then I started coaching him along with that. He since started journaling as well. One day I came to our bedroom after we put the kids to bed, and he was writing on something and then put it away. And I was like, what is that? He was like, it's my journal. And I was like, whoa, you got a journal? He's like, well, you're kind of rubbing off on me. So yeah, I would say he got coached whether he wanted to or not. And it's nice to have a partner that's going through changes too, because it makes those lifestyle changes easier because they're part of your lifestyle. And then it's nice to have someone keep you accountable as well.
Yeah, but it sounds like even though you had this partner going through it, it was still nice to have the health coach just to be there, right? As somebody who can kind of be like that outside counsel, like outside, the person who's not your spouse and has so much insight into this, right? And they've seen it time and time again.
Right. For sure. I think as healthcare professionals, the idea of getting coached, I don't think was something at the top of my mind. And I hope it's something that's getting more and more, not like a trend, but I hope people learn more about the benefits of coaching, because I sort of think of us in healthcare as like athletes. Like, we really got to take care of ourselves. We want to optimize ourselves. We don't want to just like survive. We really want to thrive in our careers. And just like these professional athletes have coaches, why couldn't all health professionals have a coach as well? So I think it's a really great tool for anyone.
Yeah. I mean, for anyone, not just our docs getting coaches, right? I mean, I think what's interesting and what we're doing on the platform is like, it's not just, these coaches are not just available to these elite athletes. Like it can be, anybody can actually get on. You can, there, like you mentioned, there's a lot of free resources. There's a lot of practitioners on our platform that offer free, low pricing, lots of free consults. So these are absolutely, we believe that this should be accessible to our, our athletes have all the different kinds of trainers and our physicians and our CEOs and all the things. But, the day-to-day person can actually get on there and have their health coaching care team as well. And I think it's really within reach now. So I think that's pretty cool.
That's amazing. That's awesome.
Yeah. So is there anything else that you would want to share with our listeners, right, about your journey? What would you want to tell our listeners who may be going through burnout right now themselves?
I would say have hope. If you're in a toxic environment, find ways to step back and, maybe slow down or stop work altogether if you are in a toxic environment. Because a lot of the times what we need is some space and distance, or a wake up call, like what I had, but hopefully you don't have a wake up call, because burnout can be really, it's not just a word we throw around when you're feeling tired. It's much more than that. And so I think it's important, if you think you have signs and symptoms of burnout, to reach out to a colleague, mentor, friend, a coach, a healthcare provider, because you want to get help. And there are ways to feel better, to be happier, to thrive. But it's really important to address these symptoms when you start to notice them.
Can you tell us a little bit about the specific symptoms that they could be experiencing with burnout? I know you mentioned yours were more GI and fatigue, but what else could these symptoms present as?
Yeah, a lot of the times it can be emotional symptoms of sort of depersonalization and just not having pleasure in, what you work so hard to do. You're not looking forward to going to work anymore. Or, you go to work and you're not, maybe you're feeling like you're kind of in a fog, whereas before maybe you were really confident and cheerful. Sometimes symptoms of burnout can be intermixed with symptoms of anxiety and depression. And so I always counsel my clients that I coach, I do a screening, because there are different ways to approach depression, anxiety, and burnout. So it's important to recognize that these could be other symptoms too. So you can have kind of the fatigue as well, physical fatigue, GI symptoms, very, very common. I've had a lot of clients tell me about, stomach issues, digestive issues, from stress, and then headaches as well, going along with the fatigue and GI symptoms.
Yeah, it's really interesting. And these symptoms seem like something that would make you want to go to your primary care physician, reach out to them first. So I think this was really great that you spelled this out, that they could present as other things, right? Either stomach issues or anxiety, depression. So I think it's really important to get that you do those screenings to, find out what exactly is going on, because this looks like it could kind of be a hidden
condition.
Yes, thank you. It's a insidious hidden condition, it seems like, that can be masked, and that we're not going to really recognize it until we hit the wall or hit some, kind of wake up call, which we're having conversations more and more. And it just sounds like these women who are into their careers and have kids and have the family, it just seems like it's hitting women a lot harder now. And we all survived COVID, but now it seems like, okay, now it's just kind of catching up with us. Do you think that's a thing?
For sure. And there have been studies showing that burnout does tend to affect females more so, especially with the pandemic, because I think the pandemic really highlighted how much women in the workforce are managing on the work front and then on the home front, right? So while we are in changing times where, like I said, our, partners are more involved, it's, in many situations, the primary childcare and household responsibility still typically falls on us as working women. And so burnout can, just be exponentially higher because of all our expectations at work, all our expectations at home. And so that's why I really think it's important to recognize signs of burnout, because there's so much on our shoulders, right? So many people depending on us. And I do think the pandemic really, highlighted that as well.
Yeah, absolutely. Dr. Shani, thank you so much for being here and sharing your insights with us on burnout and your journey. We hope this can help millions of other people who may be experiencing this or may not even know that they're experiencing this. We hope this can help them. But questions that we ask all the guests on the show, if you could, and we know you have 6, but if you could share 3 fundamental pillars that contribute to your well-being.
Yes. So number 1 is journaling. Absolutely, hands down, love it. It's super easy to incorporate into your lifestyle, and it can make such a huge impact, a huge return on investment. Number 2 is I really enjoyed audiobooks and walking. So I'm not really great at sitting down and reading a book, but I'm more of someone who likes to be active while they're resting. And I think that's, some of us just like to be like that. We're not good at like sitting and meditating. And so journaling, audiobooks with walks, and then water has been my secret weapon. Because sometimes we forget to drink water, and there's like those cool kind of tumblers on Amazon that I have one. I don't have it right next to me, but it has like the timestamp on it, which is really helpful. So if I look and it's 10 a.m., but I haven't, I've only drinking till 8 a.m. and I know, okay, I gotta, keep up with my water intake. And so I think that's really helpful for busy women to keep up with their water intake, because it can really improve your hydration, your clarity, focus, and fatigue as the day goes on.
Well, if that's what's contributing to your skin, I'm going to start putting timestamps on my water bottles. How much water do you think you're going through a day? I mean, I know what they all tell us we should be doing, and I know we're all trying. Hey, I think the water stamp, so we can know kind of where we're at during the day, is just brilliant. But how much water are you drinking?
Technically, you're supposed to drink like your body weight or half of your body weight in water. I mean, I think I try to get in at least 90 ounces a day of water. So yeah, filling up my water bottle at least twice during work with the timestamps helps me like stay on top of it.
Yeah, that is awesome. Okay, great. And can you please tell our listeners where they can connect with you and get more information on your specific coaching programs?
Yes, I am most active on Instagram at Shani_Esparaz MD. So you can find me there and DM me, and I'd be happy to chat.
Okay, awesome. Thank you so much for being here and sharing your journey with us. Thank you.
Thank you for having me, Riley.
Thanks so much for listening. This has been Sofia Unfiltered, a podcast by Sofia Health, the #1 marketplace for health and wellness. Find services, classes, and products from the top health and wellness providers. Book an appointment or join live classes now. I'm your host, Riley Reese. If this episode resonated with you, we'd love to hear about it in the comments section of your favorite podcast provider or with a 5-star rating. Let us know what your biggest takeaway from this episode was, or share it with someone you hope to inspire. Join us again next time for more real conversations, stories, and insights that help empower you with the knowledge and inspiration needed to transform how we care for ourselves.